Are you ready to take your business to the next level? Every day there are countless books and articles that are published offering the key on how to make your business a success. It's easy to feel overwhelmed trying to keep up and run your business. That's why Deb Creer created the Business Power Hour. Keep up on the latest trends, best practices, and techniques for how to make your business a success. Let the Business Power Hour do the heavy work for you.
Good morning. Good morning. I am Deb Creer, and I am passionate about giving professionals the tools that they need to make themselves and their businesses as successful as possible. Today, we're talking to a repeat guest. I love repeat guests. It means they have so much great information, but we're going to be talking more about how to make yourself better because we're going to be talking about health and in particular cancer, so we're going to talk about everything that I talk a lot about. But please join me in welcoming Dr. Michael Karlfeldt back to the program again today. Welcome, Dr. Karlfeldt. How are you?
I'm doing so great. And thank you so much for the willingness to have me back, even though, right?
You have such great information and we had such a great chat. And then you had me on your podcast. So we're just like old buddies now, right?
I love it. I mean, you have such an amazing journey.
Mm-hmm.
And it was so exciting to have you.
Well, it has been, I don't know that I'd say amazing. But I'm still here, right? And that's the important thing. So let me remind folks just a little bit about you, and then we will jump back into this conversation. So Dr. Michael Karlfeldt, ND, which is naturopathic doctor, and PhD, is a board-certified naturopathic doctor and integrative medicine expert with over 30 years of experience. He is the founder of the Karlfeldt Center, a 17,000 square foot integrative healing facility in Boise, Idaho. He is also the author of the Amazon bestseller, A Better Way to Treat Cancer, as well as co-author of the recently released book, Breast Cancer Breakthrough, Integrating Conventional and Natural Medicine for True Healing with Dr. Veronica Desaulniers. Ooh, I think I got that right. A leading voice in natural and functional medicine. Dr. Karlfeldt hosts the podcast Integrative Cancer Solutions, Integrative Lyme Solutions, and The Dr. K Show. He has also previously hosted 2 television programs on holistic health. Widely respected for his compassionate, science-informed approach, he is dedicated to bridging conventional medicine and natural therapies to support true whole person healing. So again, Dr. K, welcome.
Thank you so much. I always love hanging out with you. You bring so much joy, and so yeah, always such a pleasure.
Well, thank you. And you are a delight also. And I can see why patients come to you. Because even just over Zoom, I can feel the compassion and the caring. And I think that is what is so important.
Well, at the end of the day, it's the environment that you create for people, and that is and that's good for people just to know. I mean, what kind of environment do I want to be in, and what environment do I feel like I heal in?
Right. Yeah. Yeah. It's funny. One of the doctors that I went to, he didn't even really have an exam room. I sat on a couch. And, and now when the time came for the exam, obviously that was not on the couch, but it was a very comfortable place to be, and let's face it, even when we go into any type of medical provider for something routine, you're still going, what if, and there is the syndrome of your blood pressure goes up when you see the white coat, right? And so, yeah, just knowing that you are so compassionate and comparing and caring really does help your patients. I mean, that really is very true.
Yeah. Thank you.
Well, it's been about 18 months since I had you on last. And so first of all, tell us a little bit more about how it is that you got to where you are today, and then fill us in a bit on the last 18 months.
Well, I mean, as you know, building a business is always a journey. And, here I am still at that place where, I'm the medical doctor,
Mhm,
or
mhm,
I'm the owner and I'm
mhm,
the
mhm,
doctor,
mhm,
in addition to other doctors that I
mhm,
have, but I'm
mhm,
I'm still the doctor,
mhm.
seeing 20 to 30 patients a day,
Wow.
and then do the marketing and
Mhm,
do
mhm,
the HR and
mhm,
do all the different
mhm,
things. So building a business
mhm,
is not for the faint of heart, that's
mhm.
for sure.
Right.
I love seeing my patients,
Mhm,
and I think because of that, I've been able to kind of grow. When I came
mhm,
here to Boise, Idaho
mhm,
in 2001
mhm,
from Santa Monica, where I had my
mhm,
practice prior. I just started in a little room in
mhm,
a beauty salon,
mhm,
and uh, and now step by step,
mhm,
as you grow,
mhm,
and you want to make sure that you want to increase your ability
mhm,
to take care
mhm,
of patients and their
mhm,
needs, and you see that there's such a huge need
mhm,
in in the
mhm,
community.
mhm,
Then you grad step by step grow
mhm.
until now I'm at a 17,000 square foot building, and
Mhm.
we're talking about actually opening up a center in the East Coast as well. So we're
Ah.
looking at properties there.
Mhm.
So
Wow.
it just
Mhm,
shows the need
mhm,
of natural medicine,
mhm,
and that
mhm,
people are looking for things
mhm.
that are more restorative,
Right. Mhm,
regenerative, and where they can optimize their
mhm,
health rather than becoming
mhm,
disease
mhm,
focused and just using
mhm,
pharmaceuticals to
mhm,
mask
mhm.
symptoms. Doesn't mean
Right.
that that is not necessary at some
Right.
point,
Mhm,
but it's always
mhm,
better if you can
mhm,
build health, is always
mhm,
better.
mhm. Right. And I think more and more people are wanting to do kind of the whole body type of things, or at least explore it. And that's one of the things that I tell people when I work with them regarding their cancer diagnosis is you need to find out what is out there and then make the decision that best fits you. I chose the very traditional approach of chemo, surgery, radiation. I would probably still go that route. Now, that was over 10 years ago. I hit my 10-year mark, right? And so, especially with a stage 4 diagnosis. And so, but there's it would have been nice to have, and in those 10 years there's been changes and all sorts of things, and but there are so many people who that's not what they want to do. I mean, I was talking with somebody one time, and she had breast cancer, and she did have the surgery. She felt that was what was needed, was to get the tumor removed.
Mm.
um but then she chose to do totally natural. She's still here, and that was many many years ago, so it worked for her. But I remember the thing that she told me that really hit home. She said, I truly believe chemo would kill me. And I said, then chemo would kill you. I mean, if your brain is, and that's a good part of what all of this is, right? What is your brain telling you and doing? Her brain told her that would not work, so it wouldn't work. And so that was the thing. And I remember somebody asked me, why did I choose chemo? Now, I did have disastrous, results with my chemo. But that was incredibly rare. But she asked me why, and I said, because my brain said that was my best chance. Like I said, I don't know that I would make the same decision now. And so I think that's something that is just good for everybody. What are we thinking about? What are we putting into our body, whether it's medical, food, all of those things, and how can we make ourselves healthier? I think that's just ultimately the goal, right?
Yeah, and people, I mean, when you deal with cancer, it's such a personal journey.
Mm-hmm, mm-hmm.
And patients frequently tell me, if you're me, what would you do?
Right. Mm-hmm.
And I tell them, well, I can't really tell
Mm-hmm.
you because
Mm-hmm.
I may say something
Mm-hmm.
now,
Mm-hmm.
but if I'm in your position, yeah, it may
Mm-hmm.
completely change.
Right.
So, and it's
Mm-hmm.
always kind of finding
Mm-hmm.
that best
Mm-hmm.
integration that is best for that
Mm-hmm.
individual.
Mm-hmm.
So it's such a personal choice,
Right.
and
Right.
each tool has its
Mm-hmm.
benefits, and
Mm-hmm.
each tool has
Mm-hmm.
its drawbacks,
Right.
and it's to kind of combine
Mm-hmm.
that in the best possible
Mm-hmm.
way that the individual
Mm-hmm.
feels like, yeah, this feels right
Mm-hmm.
to me,
Mm-hmm.
and that is so
Mm-hmm.
important to
Right.
not just kind
Mm-hmm.
of make sure to not allow other people just to
Mm-hmm.
take over your
Right.
treatment,
Mm-hmm.
that you are the quarterback and
Mm-hmm.
you say that this is what I want to
Mm-hmm.
do, this feels right,
Mm-hmm.
and then you go for it.
Right. And if your medical team does not agree with you, you need new medical people. I fired several doctors on my journey for a variety of reasons. One was extremely patronizing to me. I mean, he shook his finger at me and told me not to speak. And I thought, oh, can you imagine somebody telling me not to speak? And then, of course, I turned into the 12-year-old because I let him do what and 99% of the time what he was telling me would have been right, but I'm that 1% special, right? And so then he said, so what do you think? And I was the petulant child, and I said, you told me not to talk. Right, I
So
did.
I'm not going to talk.
Yes. And he just kind of looked at me like, what? And I saw him one more time basically to tell him he had screwed up. That was just petty, right? But yeah, you have to get the best possible team around you. And I'm like, I didn't go back to one doctor because they just really didn't get my sense of humor, and we were not going to work well together. Now, when I
And
have to
and
be
and I and
serious,
I,
I'm serious, right? But most of the time I'm having fun and joking.
and I think that's really important. What you're saying is that, you are the customer,
Mm-hmm.
they provide the
Yes.
service,
Mm-hmm.
so you get to choose
Mm-hmm.
who it is that you
Mm-hmm.
want to provide that
Mm-hmm.
service.
Right.
So many people are so afraid,
Mm-hmm.
well, are they going to fire me?
Mm-hmm.
Nobody's going to want to see
Mm-hmm.
me.
Mm-hmm.
There's somebody out there who's going to
Mm-hmm.
take care of
Mm-hmm.
you.
Right.
And you want to
Mm-hmm.
find that
Mm-hmm.
right person.
Mm-hmm.
You don't,
Mm-hmm.
you want to find
Right.
somebody you
Mm-hmm.
feel I feel that I can trust my life with this
Mm-hmm.
individual. I
Right.
feel they're
Mm-hmm.
competent, they're
Mm-hmm.
compassionate, and they get me. They get
Mm-hmm.
who I am.
Mm-hmm.
They get my humor, they get maybe my
Mm-hmm.
stress about
Mm-hmm.
something.
Mm-hmm.
They're there for
Right.
me. And
Mm-hmm.
it's important to find
Mm-hmm.
that. And the healing is
Mm-hmm.
going to be so much
Mm-hmm.
better
Mm-hmm.
when you have that team.
Mm-hmm. Right. Because for one thing, when you're comfortable with them, you're more comfortable telling them what's going on. If you feel like you're just one patient out of 60 that they're seeing that day, which unfortunately is what happens with a lot, their practice or insurance or whoever tells them you will see a patient every 10 minutes, whatever it is. If I feel like they don't even exactly know my name, then I'm not going to go into much detail because I know that and I know they care. I mean, but if they don't have the time and the energy maybe to put into it and to listen to me jibber jabber for a while, then it's not going to work. It's funny. I have a multitude of doctors now, and so I have this wonderful nephrologist because my kidneys are cranky. And she's what I love about her is very, very conservative approach to dealing with this, and basically she just keeps telling me you need to drink more water, which I know, right? But at one point she told me, she said, and I see her every 3 to 4 months. And she said, I tell them to make you my last patient of the day. And I said, oh, do I talk so much that I really screw your schedule up? And she laughed and she said, well, there is that. She said, but you make me laugh. And I need that at the end of my day. And it was like, oh,
Oh.
and so, yeah, that's the thing is our medical care providers, at all levels are dealing with a lot of stress. They're dealing with people in pain. They're dealing with people who are scared. In some cases, they are dealing with people who are dying. And so I try to remember that and remember just how bad their day is too.
Yeah, I mean, and yeah, you want to have somebody where you're more than barely a
Mm-hmm.
name.
Mm-hmm.
Like you're saying,
Mm-hmm.
if
Right.
they don't remember your
Mm-hmm.
name, then how are they going to remember all
Mm-hmm.
the intricacies
Right.
of your
Mm-hmm.
medical,
Mm-hmm.
history?
Mm-hmm.
So you want to have
Mm-hmm.
somebody that you feel you can
Mm-hmm.
have that connection.
Right. Mm-hmm.
And yeah, so choosing your team
Mm-hmm.
and
Mm-hmm.
as I said, when you battle something as serious as cancer.
Mm-hmm.
Uh, it is good then to, from my point of view,
Mm-hmm.
yes, you should always have a traditional oncologist that's on board
Mm-hmm.
and that's there to
Mm-hmm.
kind of monitor
Mm-hmm.
and
Right.
image
Mm-hmm.
and
Mm-hmm.
then whatever amount of care you
Mm-hmm.
want from the traditional
Mm-hmm.
oncology, you accept
Mm-hmm.
that,
Mm-hmm.
and then you can then
Mm-hmm.
add that
Yes. Mm-hmm.
add the
Mm-hmm.
integrative care
Mm-hmm.
where we
Mm-hmm.
integrate, things
Mm-hmm.
like, healthy eating,
Mm-hmm.
healthy lifestyle,
Right.
healthy
Which we
thinking.
should be doing anyway. Right. Mm-hmm.
Absolutely.
Mm-hmm.
Absolutely. Because, I mean, everything has a root cause.
Mm-hmm.
Everything is
Mm-hmm.
coming from
Mm-hmm.
somewhere.
Mm-hmm.
So if you're battling, cancer,
Mm-hmm.
there's a reason
Mm-hmm.
for that to take place.
Right.
So
Mm-hmm.
you want to
Mm-hmm.
investigate that, and then you don't
Mm-hmm.
want to have the same outcome
Mm-hmm.
again and again. So
Mm-hmm.
you want to
Mm-hmm.
change the initial
Mm-hmm.
condition. So you want to
Right.
change
Mm-hmm.
lifestyle, want to
Mm-hmm.
change how you're eating,
Mm-hmm.
and then you can bring in, there's so many
Mm-hmm.
powerful supplements
Mm-hmm.
and
Mm-hmm.
herbs and
Mm-hmm.
other therapies that we do here at the
Mm-hmm.
center, but that's available a little bit all over
Mm-hmm. Mm-hmm.
that you can bring in.
Mm-hmm. Right. And if you have the traditional doctor at whatever level it is, and if they don't want to talk about integrative therapy and things like that, to me that's a red flag. And I know in some cases they're concerned about your health, right? They want to make sure you're making the right choices, but sometimes they're also threatened. And oh, you're going to go do that and not work with me. No, I mean, I've had several doctors who I've talked about, simple basic things like nutrition, all of those things which we should be talking about anyway. And they have also, what can we do to help? Now it's really funny when I go to my oncologist, and I'm still going every 21 days for treatment. I was, talking, and I love my oncologist dearly. I was talking to her about some of the GI issues that I have, which are, a result of everything going. Well, now I get to see the nutritionist every time, and she is very sweet, and she gives me, but she's very knowledgeable. And the nice thing is I can tell that she has at least glanced at my chart before she talks to me. And I mean, that's all I ask. I'm guessing mine is probably the size of War and Peace at this point. But yeah, she remembers this is what's going on, and here's what's happened. And when I've had doctors that haven't done that, that's the other thing that annoys me, because how can you be treating someone if you don't at least remember the last time you saw them? I my third cancer was thyroid cancer, which may, there were several reasons that might have come up, not the least of which is I did have radiation. And that is talked about in the new book. And he acknowledged that. He said we should have been watching it very closely because of that. But I had an ultrasound just as a checkup, and it showed a lesion. And of course, you get that in my chart long before you talk to the doctor. I hit the panic button, and I texted him, and I said, I'm skipping ahead. Let's just do a needle biopsy. And because I'm like, I know what this is. I'm not going to, let's just skip ahead. And he responded. He's very good at texting. I mean, he really, that's his, he really loves doing it. Much younger, right? And he said, let's watch it. He said, you're in here in a couple weeks. We'll discuss it then. He said, but and he said, what I think is happening is you've probably got a small infection somewhere in your body, and your lymph nodes have flared up a bit. And so, and I was kind of, but I happened to see my oncologist within a couple of days of that. And I told her, and she agreed with him. But my lab work showed a little bit elevated, some stuff for pointing more to an infection. And she said, but this is really bothering you, isn't it? And I said, well, of course it's bothering me. And so she did a referral. And within a week, I was at an ENT who did another ultrasound and said they were right. It was just a small infection. He said, but, good on you. I'm wanting to double check. But the key thing was when and I let my endocrinologist know that. But when I saw him in a couple of weeks, he started with an apology. And I was kind of startled. And he said, I did not look at your chart and I forgot your history. He said, I responded the way I would have most of the time. He said, and I shouldn't have done that. And I'm very sorry, which ingratiated me to him even more. Right.
Yeah. I mean, that's amazing.
Mm-hmm.
That's amazing.
Mm-hmm.
And anyone that's willing to accept that
mm-hmm.
they were wrong,
right.
and
Mm-hmm.
and willing to look
mm-hmm.
you into the
mm-hmm.
eyes and
mm-hmm.
say that,
mm-hmm.
I
yeah.
can do better.
Mm-hmm. yeah.
And then
mm-hmm.
that feels even
mm-hmm.
better.
Mm-hmm.
They're not acting
right.
out of pride.
Mm-hmm.
And I think it is, one of the things that a lot of cancer patients
Hmm.
have a difficulty navigating
Hmm.
is exactly what you're
Hmm.
mentioning is how do I
Hmm.
communicate these other things
Right.
that I'm
Hmm.
doing
Hmm.
outside of the
Hmm.
care that they're
Hmm.
offering?
Right.
And then it
Hmm.
is important to
Hmm.
understand that the oncologist
Hmm.
is trained in
Hmm.
what he is trained in.
Hmm.
Yeah.
Hmm.
He is not knowledgeable in nutrition. He's
Hmm.
not
Right.
knowledgeable about herbs. He's
They
not
have other people for that. Hmm. Hmm.
exactly.
Right.
And so they are
Hmm.
essentially going to take the safe route,
Hmm.
which is,
Hmm.
it's not studied, we
Hmm.
don't
Hmm.
know. And in reality is
Hmm.
that the majority of these things are heavily studied.
Hmm. Hmm.
Vitamin
Right.
C IV,
Hmm.
there's
Hmm.
huge amount of
Hmm.
research in regards to
Hmm.
cancer.
Hmm.
Curcumin,
Hmm.
mushrooms,
Hmm. Hmm.
beta-glucans, all these different things have a
Hmm.
lot of studies,
Hmm.
but the oncologists are not aware of them,
Right.
and they are
Hmm.
not taking the
Hmm.
time
Hmm.
to study
Hmm.
because that's not their field,
Right.
and they are
They're
stepping.
keeping up with what they're doing.
Exactly. And if they if they start to counsel in areas that is not
Yep.
their
Oh,
jam,
that's
so to
bad.
say, then all of a
Hmm.
sudden they can become very liable.
Right.
And
Hmm.
so
Hmm.
and so as a patient
Hmm.
understand the position
Hmm.
that the
Hmm.
oncologist is in,
Hmm.
and then also know what their
Hmm.
expertise is
Hmm.
and what they can talk
Hmm.
about.
Right.
So I
Hmm.
think just kind
Hmm.
of knowing
Hmm.
that when you communicate with them, it means that when they say,
Hmm.
no, don't do
Hmm.
that, it usually comes
Hmm.
from that they don't know,
Hmm. Right.
and they just
Hmm.
feel like that is a safer
Hmm.
route.
Right. And it's funny, I tell people that my oncologist is my boss. Now, that's she and I work very closely together but all my other doctors do coordinate with her. And it's funny, I'm going in a couple of weeks for some dental surgery. And part of the reason why we're having a delay is because that oral surgeon wants to coordinate with my oncologist. And even though it has absolutely nothing to do with it, he said, I need her to be in the loop. And I really like that. And of course, all my other doctors, they all coordinate very well together. But it also kind of points to the fact that it's also our responsibility as the patient. If we're taking supplements, especially supplements and things, it's one thing to start eating more kale, but if you're taking supplements and things like that, it's very important to tell your medical team because it could cause issues. There could be all sorts of things. I remember I asked my doctor, I'm in Georgia, and use of CBD down here is still pretty restrictive. It's pretty much still just for things like seizures, for children, um, uh, pain and nausea, right? Those and it's really restrictive on that. I mean, it has to be a medical doctor who's prescribed it, all of those things. And so I asked my oncologist, I said, I don't want any of that. I'm just curious. And she said, as a practice, she said, sometimes it is the only thing that will help with nausea. She said that's just, but the only thing that they use typically. And she said, but as a practice, they decided not to prescribe it. And I was kind of curious, and because in other places it's obviously very open and things, and I liked her rationale. She said there are still nothing that really monitors how it's processed, what dosage you're getting, what level of things are. And she said we're just too uncomfortable with it, causing possible problems with chemo medicine. And I like that. They had made a rational decision. And if I had decided to still use something like that, I would have told her, and she probably would have made a face at me. But yeah, I like that they had, it wasn't just no, we can't do that. And she said, but we're continually reviewing things because things change. And so I like that. I mean, they're a very forward thinking practice.
Yeah, and you have to respect that
Mm-hmm.
they
Mm-hmm.
come, this is how they want to run their practice,
Mm-hmm.
and then you just need to
Mm-hmm.
respect how that is. But
Right.
obviously, you as an
Mm-hmm.
individual,
Mm-hmm.
it's
Mm-hmm.
ultimately up to
Mm-hmm.
you.
Mm-hmm.
And in regards to it's when you come to things like herbs and
Mm-hmm.
and
Mm-hmm.
and there's not going to be the same ability to do kind of where you measure the
Mm-hmm.
exact active
Right.
ingredient as you would with a
Mm-hmm.
pharmaceutical. So there's a little bit of different
Mm-hmm.
ways that it is being studied.
Mm-hmm.
And then obviously a lot of people in the medical field that
Mm-hmm.
are used to the double-blind study
Mm-hmm.
and all
Mm-hmm.
your
Mm-hmm.
monitoring is one active ingredient,
Mm-hmm.
which is a pharmaceutical
Mm-hmm.
drug. It's just a
Mm-hmm.
chemical
Mm-hmm.
ingredient. And that is all you have. When you
Mm-hmm.
look then at herbs,
Mm-hmm.
let's say a mushroom
Mm-hmm.
turkey tail,
Mm-hmm.
you know, one mushroom is not going to have the same amount of constituents
Mm-hmm.
as the other mushroom.
Right.
So it's very, very hard then
Mm-hmm.
to do the exact
Mm-hmm.
same study,
Mm-hmm.
looking at
Right.
the active
Mm-hmm.
ingredient
Mm-hmm.
because there's so many
Mm-hmm.
different cofactors
Mm-hmm.
that then support the
Mm-hmm.
function of the body.
Mm-hmm.
So it's not just the
Mm-hmm.
active ingredients, but it's 1,000
Mm-hmm.
other components
Right.
that kind of work
Mm-hmm.
together and
Mm-hmm.
enhance it. And it's so hard in a research setting
Mm-hmm.
to really be able to
Mm-hmm.
kind of say that this is
Right.
the
Mm-hmm.
exact
Mm-hmm.
effect of
Mm-hmm.
this and this is the exact
Mm-hmm.
effect of that. So
Mm-hmm.
then you have to have somebody that's very
Mm-hmm.
knowledgeable in knowing
Mm-hmm.
that, let's say you do this chemo
Mm-hmm.
agent, doxorubicin
Mm-hmm.
or
Mm-hmm.
5-FU, whatever it may
Mm-hmm.
be, and then knowing that there are studies out
Mm-hmm.
there to show what enhance, the
Mm-hmm.
effect of
Mm-hmm.
that drug. For
Right.
instance,
Mm-hmm.
you can bring in a biflavonoid like
Mm-hmm.
quercetin,
Mm-hmm.
and it actually has proven to interfere with what's called chemotaxis,
Mm-hmm.
where you're then where
Mm-hmm.
when you're infusing a chemo agent,
Mm-hmm.
and then the cancer cell is having a defense
Mm-hmm.
mechanism where it's spitting it
Mm-hmm.
out again.
Mm-hmm.
And so they've seen that with bringing in the simple things like
Mm-hmm.
quercetin,
Mm-hmm.
it actually interferes with the cancer's ability
Mm-hmm.
to spit it out,
Mm-hmm.
which means that it will then it can actually increase and the effectiveness
Mm-hmm.
of the chemo up to like
Right.
30%.
Mm-hmm.
So
Right.
it's all these
Mm-hmm.
different things that you can then, and that's in the book,
Mm-hmm.
for the breast
Mm-hmm.
cancer, breakthrough.
Mm-hmm.
But obviously, it is very similar for other types of
Mm-hmm.
cancer.
Right. Mm-hmm.
So it's knowing how having
Mm-hmm.
somebody that's
Mm-hmm.
knowledgeable
Mm-hmm.
to guide that
Mm-hmm.
part,
Right.
alongside with your
Mm-hmm.
oncologist.
Mm-hmm. Right. And I think, especially in the traditional medical world, they have finally or are finally figuring out every person is different. They have their regime. You will get this and this and this, but it's going to work different on a 30-year-old woman as opposed to a 50-year-old woman who had 5 kids, right? And is maybe perimenopausal. I mean, all of those things. And and it's the same with the patient. We're going to make different decisions. When I just I did have a double mastectomy, and I had decided absolutely not on reconstructive. Now I went to the plastic surgeon just kind of to see. I mean, he was very nice, and I discovered later he does all of the housewives of wherever, right? So yeah, nicest doctor's office I'd ever been in. But that was just, and he was very nice and all sorts of things. But I had never talked to anybody who didn't eventually have issues with implants, all sorts of things. And I thought, I'm old. Yeah. I don't need those any longer. But if I had been 30, that would have been a totally different decision. And again, my doctors went, okay. I mean, there was no, have you thought of it? They just, well, now they knew I'd thought about it. I wasn't going to say, hey, I want to do this. But yeah, when I said no reconstructive, they went, okay. But yeah, we are going to make different decisions based on where we are in our time of life.
And also, it's important to recognize the complexity of
Mm-hmm.
our system. I
Mm-hmm.
mean,
Right.
you talk about, a 30-year-old is going to be impacted
Mm-hmm.
differently than a 60 or 70
Mm-hmm.
year old.
Right.
But also, I mean, we consist of like 30 trillion cells, and we have
Right.
each
Yeah.
cell,
They're going to
there's like,
act differently. Mm-hmm.
yeah, it's a
Mm-hmm.
lot.
Mm-hmm.
Yeah. And each cell is like a million reactions
Mm-hmm.
every
Mm-hmm.
second.
Right.
So
Mm-hmm.
the complexity of,
Mm-hmm.
of the body,
Mm-hmm.
and then also knowing that the pharmaceuticals,
Mm-hmm.
obviously, they're studied on a
Mm-hmm.
bell curve. Yeah. So
Mm-hmm.
it's not going to have the same
Mm-hmm.
effect on each
Mm-hmm.
individual, and each individual's
Mm-hmm.
system is going to be different.
Mm-hmm. Right.
And our
Mm-hmm.
systems are so complex.
Mm-hmm.
So it is so, as you are then
Mm-hmm.
using pharmaceuticals or herbals or
Mm-hmm.
whatever you may
Mm-hmm.
be,
Mm-hmm.
using, just know that there's an
Mm-hmm.
average,
Mm-hmm.
but
Right.
how many people are
Mm-hmm.
the average?
Mm-hmm.
We're all
Mm-hmm.
outliers in some
Mm-hmm.
ways.
Mm-hmm.
So listen to your
Mm-hmm.
body, what feels right, and it kind
Mm-hmm.
of communicate
Mm-hmm.
to your doctors
Mm-hmm.
that, this feels like too much,
Mm-hmm.
or
Right.
I can do
Mm-hmm.
more, or
Right. Mm-hmm.
and so
Yeah.
having that
Mm-hmm.
conversation and recognize the
Mm-hmm.
intricacy of your own
Mm-hmm.
body.
Right. And I remind them I'm not average. Because they'll say, hey, this is high, this is low, whatever. And I say, well, maybe that's my average. And I just run hot, I run cold, whatever it is. I mean, and I think that's one of the things is when we're healthy, we don't get good baselines. I mean, and of course those change, as we age and things like that. But yeah, so then we don't even know what our average is. It might be normal for us and abnormal for the the majority of people, and that's where it gets tricky. And then I also remind people that you do have to constantly communicate with your doctor. I was talking with someone who had started chemo and was very ill. The nausea was a lot, and I said, did you tell your doctor? And she said, well, no, it's supposed it this is what happens. I said, oh. I said, first of all, they might need to change the regime, the treatment protocol. They might be able to prescribe something. And I said, and it might not be even normal. I said, just tell them, and maybe you need to keep a diary. Ate this came back up, whatever it was, because and I said, even if they do say, well, yeah, that was to be expected, you still have told them, because then if something changes, you've got that in there also.
Yeah, and that, as a doctor, I
Mm-hmm.
mean, I know myself.
Mm-hmm.
You put these different symptoms
Mm-hmm.
together and
Mm-hmm.
create a
Mm-hmm.
picture.
Right.
So
Mm-hmm.
if there's certain symptoms that are not communicated,
Mm-hmm.
and
Mm-hmm.
yes, there may not be that
Right.
everything is
Mm-hmm.
important,
Mm-hmm.
but you as a patient, you don't know.
Mm-hmm.
And so it is good then
Mm-hmm.
to, when
Mm-hmm.
things change,
Mm-hmm.
then to communicate
Right.
that. And that gives the doctor the
Mm-hmm.
opportunity to even
Mm-hmm.
though they may not make an
Mm-hmm.
adjustment at that time,
Mm-hmm.
it will be in the back of
Mm-hmm.
their head.
Mm-hmm.
And then when something else
Mm-hmm.
happens, they say,
Mm-hmm.
this
Right.
correlates,
Mm-hmm.
and that is
Mm-hmm.
probably this that's
Mm-hmm.
going on,
Mm-hmm.
and this is how we would
Mm-hmm.
address it.
Mm-hmm.
So
Right.
yeah, having that
Mm-hmm.
communication
Mm-hmm.
is so
Mm-hmm.
crucial.
Right. And nothing is too small, right? Several months ago I was in, and they were, how are you doing? And I was kind of, but one of the things I said was, I'm just really tired. And they kind of perked up. And they said, is this, more than, and I said, yeah, it seems to be kind of more than, but I mean, tired. Why would I, and she said, when was the, if you had your B12 tested? I said, I don't know. You run the tests, right? And so, we always pull a little bit of extra blood, just in case there's something. And they tested my B12, and a couple days later my phone rings, and it's, I always think it's never good when they call you, right? And it was the PA who I adore, and she said, oh, she said, your B12 was 79. And I went, okay. I mean, I have no idea, was that good or bad? And she said, I've been doing this however many years, I've never seen a level that low. I went, oh, well, you realize I'm special. And so, I got to give myself B12 injections, and, but yeah, just, and it really was amazing how fast I kind of perked back up. And so now that is just one of the things that we now always monitor. But yeah, I mean, it was just as simple as saying, I'm more tired than usual.
And it exactly, and it's good then to be able to
Mm-hmm.
communicate and then allow then
Mm-hmm.
the
Mm-hmm.
doctor to
Mm-hmm.
respond.
Mm-hmm.
And there is, in regard to kind of the integrative
Mm-hmm.
aspect, a
Mm-hmm.
lot of times the medical doctor,
Mm-hmm.
they only do very basic
Mm-hmm.
labs
Mm-hmm. Right.
until
Mm-hmm.
there's a medical
Mm-hmm.
reason they
Mm-hmm.
feel to do
Mm-hmm.
something else because of the
Mm-hmm.
limitations
Right.
sometimes
Yeah,
of
they're not going
what
to run
insurance,
everything every time. Mm-hmm.
no, what insurance companies
Mm-hmm.
cover, not
Mm-hmm.
cover.
Mm-hmm.
And then sometimes, and that may be when you go to somebody like myself, then there are other markers outside that we look at just for functionality,
Right.
not just for disease prevention or disease management, but we can then look at these other markers and to see functionally what's going on and how can we optimize. Like for
Right.
instance, I look frequently, and I talk about this in both of my books. Um, when you do a CBC, for instance, a complete blood count, uh, I look at the neutrophil, the lymphocyte, the monocyte, and look at the ratios and knowing, what the ratios are optimum. For a medical oncologist, they look at that and just see, well, are they good enough to receive chemo, or are
Right.
they good enough to not be in crisis? So they are doing a lot of the crisis management, and then you can, utilize a integrative doctor to maybe kind of look at things and see, what else can we look at to optimize things? And
Right.
also, are there things that we can assess to see, am I dealing with heavy metals? Am I dealing with chemicals? Do I have underlying, chronic infections? Like we know that there are, the parasites that can impact, creation of cancer. There are fungus that can impact even Lyme disease, like tick-borne illness. They see that the pathogen, the spirochete Borrelia, actually trigger the same kind of reactions within the cell like a cancer cell would
Oh.
do. So you see that there are direct correlations between then different infections and cancer. And then we know, obviously, if you've been a hairdresser or a car
Right. All
mechanic
those
or,
chemicals that you're
yeah,
absorbing.
those, and we know how they interfere with your hormonal system, and we know how they interfere with your immune system. And so looking deeper sometimes under the hood and clearing out these root causes that would have put you in the place where you're at now is very, very valuable. And that is a beauty when you kind of use somebody like myself, where you look kind of functional a little bit deeper,
Right.
because a lot of medical doctors don't have that time to sit down
Right.
with you and
Right.
kind of go through all these things. Then they don't utilize those tests because they're not covered by insurance,
Right.
a majority of
Yeah.
those.
Yeah. And it was interesting. So you mentioned your new book, Breast Cancer Breakthrough. And as I was reading it last night, it was, I thought, oh, and it is I recommend it for anyone, whether you're dealing with cancer or not, because there's so many beneficial things like nutrition, and it tells us get enough sleep, right? I mean, some of these things that are basic that we don't even think about doing. But yeah, as I was reading the book, I did think I probably still would have chosen the same treatment methodology, but I would have asked for some additional type of things, and maybe that would have stopped the big complication that I had. Maybe I wouldn't have gotten thyroid cancer, or my third cancer is basal cell carcinoma, which always I tell people it sounds horrible and awful, right? It's your basic skin care or skin cancer, and I am a freckly redheaded kid that grew up in the mountains of Colorado. Everybody's always surprised that I was in my 60s before I got skin cancer. But yeah, could I have done something? Could and now I don't like kale. I'm not going to eat kale. But the thing about the book is it's not you have to do all of this. It's if this sounds like it would work for you, then think about it. But consider what this is doing and what that is doing. We were talking before the program about our fillings in our teeth, right? Those of us of a certain age have metal fillings. And when we stop and think about it, it can't be good for our bodies to have metal in them. Now, I mean, that was the preferred and standard treatment at the time. But maybe we need to think about something different. Or, okay, I can choose between an apple or a candy bar. I will choose the candy bar every once in a while because we have to live life, right? But maybe I would choose the apple more often. And I love that you talked about in the book about how beneficial apples were. My husband eats an apple a day, and I think it really is, keeps the doctor away type of thing, right? But yeah, the book was so informative on everything, and a lot of it you really would just ask your oncologist, your primary care, whoever, hey, run this test. If I have to pay for it myself, I'll pay for it myself, but I want to know what that is.
Yeah, and then yeah, in the book, yeah, we so I co-wrote it with Dr. Veronique Desanier,
Mm-hmm.
also known as Dr. V, because that's a whole lot easier to
I
say.
know, I know.
Yeah.
Mm-hmm. Is she French? It looks like a French name.
Yeah, yeah, it's
Mm-hmm.
I mean, beautiful, yeah, a wonderful woman.
Mm-hmm.
She dealt with breast cancer
Mm-hmm.
twice,
Mm-hmm. Right.
and so through her journey, yeah, she then learned what worked, what
Mm-hmm.
didn't work,
Mm-hmm.
and then she created then a organization called Breast Cancer Conqueror.
Mm-hmm. Mm-hmm.
That I actually, you've asked me, what has changed since last time we
Mm-hmm.
spoke. That is one thing that changed because
Mm-hmm.
she wanted to retire
Mm-hmm.
and I didn't want her legacy to go away
Ah.
because
Mm-hmm. Mm-hmm.
she supported thousands and
Mm-hmm.
thousands of people
Mm-hmm.
throughout the world
Mm-hmm.
that dealt with breast
Mm-hmm.
cancer and using the
Mm-hmm.
natural ways.
Mm-hmm.
We have a coaching
Mm-hmm.
program that can kind of walk
Mm-hmm.
alongside a
Mm-hmm.
person as they are on their
Mm-hmm.
breast cancer
Mm-hmm.
journey.
Mm-hmm.
So her original book was just
Mm-hmm.
all about, the natural, how
Mm-hmm.
to do it naturally,
Mm-hmm.
which is
Mm-hmm.
really, really powerful.
Mm-hmm.
But more and more people, like we're talking
Mm-hmm.
about, they are needing to have guidance in
Mm-hmm.
how to navigate this
Mm-hmm.
integrative
Mm-hmm.
space where we
Right.
bring in
Mm-hmm.
both
Mm-hmm.
together. I'm going to
Mm-hmm.
do radiation.
Mm-hmm.
So how should I prepare myself for
Right.
radiation?
Mm-hmm.
What can I do to
Mm-hmm.
heal after
Mm-hmm.
radiation? Or
Mm-hmm.
going to do surgery?
Mm-hmm.
It is more than just that they're removing the
Mm-hmm.
tumor. What
Mm-hmm.
impact does it have on my immune
Mm-hmm.
system?
Mm-hmm.
Does it put me in a place where maybe there are things that can spread?
Mm-hmm.
And
Mm-hmm.
chemo, what these different
Mm-hmm.
chemo agents, I talked about
Mm-hmm.
quercetin,
Mm-hmm.
and how that could be
Mm-hmm.
beneficial. But in the book, then I go through the common
Mm-hmm.
protocols that
Mm-hmm.
are used
Mm-hmm.
for breast
Right.
cancer
Mm-hmm.
patients, and
Mm-hmm.
then go through, these herbs
Mm-hmm.
are beneficial.
Mm-hmm.
These are things you should
Mm-hmm.
not do.
Mm-hmm.
And so
Mm-hmm.
people know how to navigate
Mm-hmm.
that space because it is so difficult. It's
Mm-hmm.
so confusing because
Mm-hmm.
it feels like it's two polar opposite
Right.
worlds
Mm-hmm.
and that they are
Mm-hmm.
in
Mm-hmm.
war with each other and
Mm-hmm.
they are not.
Right. It's
They
integrative.
correct,
Mm-hmm.
correct.
Mm-hmm.
And like we
Mm-hmm.
talked about, it is integrating it
Mm-hmm.
in a way that feels right to
Mm-hmm.
you.
Mm-hmm.
And so obviously knowledge is power. That's
Mm-hmm.
why we wrote the
Mm-hmm.
book.
Mm-hmm.
And then you can kind of feel
Mm-hmm.
that, yes, this is something that I
Mm-hmm.
can see is missing in
Mm-hmm.
my life.
Mm-hmm.
And that may be one of the
Mm-hmm.
reasons why I'm not
Mm-hmm.
as well as I would
Mm-hmm.
like to be. So
Right.
I can bring that
Mm-hmm.
in. It will support my ability to
Mm-hmm.
heal,
Mm-hmm.
my immune
Mm-hmm.
system. And so we talk about
Mm-hmm.
the seven essentials,
Mm-hmm.
that are, the seven core
Mm-hmm.
principles, and then also stepping into, how to
Mm-hmm.
navigate this
Mm-hmm.
integrative space.
Right. And it's not good just for those who have breast cancer. It's any type of cancer, but more importantly, a lot of it is preventive. Now, nobody ever wants to get cancer. They're not doing anything to get cancer. I'm always amazed at the people who smoke 2 packs a day and don't get cancer. But there are things that we could be doing. Maybe it will keep it from happening, or if it does happen, it will be reduced. And I mean, one of the easiest things, many years ago, I worked for the American Cancer Society, and preventive care and early detection is obviously, the key thing. Yeah, cancer rates are high and keep going up, but a big portion of that is because of early detection, and things like that. But yeah, if you, the idea is to go into whatever it is as healthy as you possibly can. And I don't care if it's cancer, Alzheimer's, any of that. The healthier you are, the less it's damage it can hopefully do to your body.
Yeah, I mean, if you walk into a surgery,
Mm-hmm.
and to your point,
Mm-hmm.
if you have strengthened your tissue,
Mm-hmm.
you
Mm-hmm.
clean out some of the
Right.
toxins,
Mm-hmm.
and you bring in nutrients
Mm-hmm.
to help you to heal
Mm-hmm.
faster, and your
Mm-hmm.
immune system is in tip-top
Mm-hmm.
shape to heal after,
Mm-hmm.
you're going to fare so
Right.
much
Mm-hmm.
better,
Mm-hmm.
and you're going to
Mm-hmm.
feel so much better.
Mm-hmm.
And there are some tricks as well if you go through chemo. For
Mm-hmm.
instance, they see research people
Mm-hmm.
that are then fasting
Mm-hmm.
around chemo.
Mm-hmm.
It actually
Mm-hmm.
it protects the healthy cells
Mm-hmm.
from the effect of the
Mm-hmm.
chemo,
Mm-hmm.
and it opens
Mm-hmm.
up the cancer cell for the chemo.
Mm-hmm. Right.
So it's these little tricks that are
Mm-hmm.
so
Mm-hmm.
important.
Right. And one of the things that was talked about in the book are the cold caps, right? And it helps with the hair loss. And it's funny, I go in every 21 days, and I have seen people in there who have these cold caps on. And and you might have to pay for it yourself, and it's one of those things where it's like, for some people like me, I was like, okay, so I'm going to lose my hair, whatever. But for other people, that's incredibly important to them. And so yeah, that's it. And I don't think I would have done a cold cap. I was like, whatever. But I, for someone else, yes, just the same as somebody else is going to say, I want reconstructive surgery. It is very different. And especially for women who our outward appearance is so very important, not just to us, but society, all of those things. And so yeah, it's and that was what I liked about the book, is there were so many different topics that it covered that at least are going to get you thinking.
And you're absolutely right as well. I mean, it isn't just a book for people going through their cancer journey. It isn't just, even though breast cancer breakthroughs, the same principles are the ones that apply for you to be able to minimize your risk. So
Right.
you can never say that do this and it's going to prevent cancer.
Right.
You
And
can
we
never
all,
say that.
we've seen Olympic athletes, for example, who, get cancer. They're probably they're incredibly healthy, but there's just something happening.
Yeah. And so by doing these principles, you just put yourself, if you learn to kind of, how should I address stress, and how, I have trauma in my life, how do I resolve that? Because these are things that are, playing as
Right.
a kind of an app in the background and kind of sucking energy out of you. So how can I clear that out? Because cancer, it doesn't just happen. It's a process that develops over a long period of time.
Right.
And when it gets to the point where the body can't compensate anymore, then it shifts into these cells start to shift into different
Right.
behavior. But that's taken years and years. So
Right.
if you are in a place where you're not concerned about cancer, doing these type of principles, the 7 essentials, is going to put you in a much better place.
Right. And you mentioned stress. And I love that you mentioned that, because I think so many people totally forget that is something that, it can cause so many issues. We always think of stress and ulcers, right? And things like that. But when you are, it's stress affects your entire body, and I try to are there bad times? Yes. But I also try and laugh and enjoy and have as much fun as possible. I don't watch the news a lot. I know what's going on in the world. I don't need to watch the news. I'm not burying my head in the sand, but I don't also need to have the news on 24/7. I skip past those toxic posts on Facebook. I don't have to read it. And I don't care what it is that they're talking about. If it's I don't have to read it. Now, if it's something where somebody is struggling and I might be able to, that's different. But if it's just, and I think stress really is one of those things. And then of course we have the opposite of that, right? And one of the things that I like to talk to a lot of people about is how laughter is such a beneficial thing. I co-host another podcast on cancer and comedy. And do we have serious discussions? Yes, but we also talk about how beneficial laughing is, and even fake laughing, because your brain doesn't know that you are going ha 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 ha. It thinks you're laughing, right? And so you start getting those benefits. I do try and make my care providers laugh. If they know me, when I check in, I tell them I'm Anastasia Beaverhausen. And just all these things that we can do to kind of make life a little bit easier and more enjoyable, because it's scary. Yeah. I mean, are there times where I wake up and think, this is horrible? Yes, we're human. But then it's like, okay, let's find something to laugh about.
Yeah, and what you're talking about, it bleeds into what we kind of did earlier in our discussion, is our mindset.
Right.
Knowing that the power of our mind, we know that the white blood cells, they have receptors
Yes.
for your brain chemicals. So
And they
whatever
have a
you're thinking,
memory.
so whatever you're thinking, whatever your attitude is, if you're laughing, if you're happy, so think of your white blood cells having the same attitude as you do. If you feel hopeless, afraid, your
Then they're
white
going to
blood
kind of
cells,
shrivel up and
yeah, they're going to have these stress hormones and land onto these poor white blood cells, and they're going to be so confused, and they're going to
right.
try to attack everything and going to run around like a very anxious person.
Right.
If you're happy, if you're,
They chill.
yeah, we just, and they studied this to really see that your natural killer cell activity, their production of them, their effectiveness. It's so much better when you are laughing and having fun. I mean, you had Norman Cousin, he wrote a book, things like Happy Healing or something like that. I
Yes.
can't remember. But it was essentially he was dealing with a lethal diagnosis, and he said, "Well, I'm just gonna watch funny movies. I'm gonna be laughing all the time." And he cured himself from
Right.
that condition.
Yeah. Well, I always remember years ago, I think 35 years ago or so, I worked for an oncologist. You would have loved him and he has unfortunately passed away. But 35 years ago, he talked about integrative medicine. And I remember one of the things that he would tell patients. Now, I was office staff, certainly not medical, but he would tell patients 99% of this journey is in your head. If you think you're going to die, you will die. If you think you're going to live, you will live. Now, I mean, he wasn't saying, poof, the cancer is going to go away. And maybe you have 5 days. I mean, who knows? But how are you going to live in that time frame? Really was what he was talking about. And I thought about going back to Denver when I was first diagnosed, and then I realized, oh, he had long retired, right? But yeah, I just and that was really his thought process. And we had patients that did not want treatment. And as long as he thought they were educated, making good decisions and not just out of fear, he was fine with that. And he would say, "What do you need me to do?" And I remember, I mean, this is 35 years ago. Doctors didn't say that. But yeah, I mean, he firmly believed that your attitude is a big part of how you're going to deal with this.
Yeah, and especially when you deal with something as scary as cancer. Here you're looking at your own mortality, and you don't know, am I going to have the next day? And every little pain,
Right.
thinking, oh, is it cancer advancing? What's happening? I see this swell a little bit, or see, stomach ache. Is it in my stomach? So it is very scary. So in that process, and it is you have to work harder trying to shift and recognize, God gave me this day. If I only have this day, what do I want to do?
Right. Yes.
And
Gratitude
really,
is
yeah.
immense.
Yeah, because if you program your body based upon your fear, what you are afraid of, that becomes your gravity point.
Right.
And then you program your body that this is the reality. This is what this is, what I'm programmed to do.
Right.
And I kind of I do dislike when oncologists say, you have 3 months left to live, 6 months left to live, whatever. It becomes like a programming in your body.
You've put a date in there, and
and I've seen that so many times. They're given that date, and it's like it becomes a prophecy. So you have to disconnect from that and then focus on living rather than being afraid of dying.
Right. We've been saying, you have that fear, you've got that anxiety, and that is perfectly normal. And for people who need additional assistance because of that, please reach out. If you need a counselor, if you need, whether it's, a psychologist, a minister, a support group, whoever, it's just going to make you stronger to say, hey, I need help. That was not me. I was like, well, but yeah, I know for other people, they need that. And that is perfectly fine for them to say, I need help. and yeah, so don't think, okay, we're going to say this is all happy go lucky. You might need assistance, and back to the CBD thing, you might need no.
Well, and that's the thing is that we talked about building your team, but it's also important in addition to your team, what's included that is it's your community.
Yes,
And
yes.
we know through studies that loneliness kills more people
right.
than
Yeah,
smoking.
the book talked about how, especially, breast cancer is predominantly in women, obviously. And the book talked about the power of a woman's community and how having supportive women friends helps with all that. And I saw that. I was, it was my and I actually had bracelets made for him that said sister. I mean, all sorts of stuff, right? Because I'm an only. And and having those supportive women, and I still do, are just absolutely incredible.
Yeah, yeah. And that way and it's good to communicate with them because sometimes your community will start to push therapies on you out of their fear.
Right. Oh
So
yeah. Grandma had this. I love those.
yeah, exactly. So it is, you need to just kind of respectfully communicate with them that, yeah, I appreciate your concern and I appreciate the love, that you have for me. This is what I'm choosing to do. Can you please respect me and,
Yeah.
and support me in my choices? Because at the end of the day, you are the one going through it. It's not your aunt. It's not your daughter. It's not your high school friend. They are there to support you. And yes, you can listen to them, but at the end of the
Right.
day, they need to respect your journey and please, feel strong enough to communicate that.
Right. Yeah. And if they can't respect that, then gently push them away.
Yeah.
And that's perfectly fine. I love the people who, well, my grandma had this and yada 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 yada. Oh, she died. They always end with that. And I'm like, that's not helpful.
No, I don't want to hear everyone that's had cancer and died.
Right.
If I'm diagnosed, I don't want to have all those
Mhm.
sad stories.
Yeah. I want
You
him to
know,
say this person is going strong 30 years later.
yeah, exactly.
Right.
Let's
Right.
let's bring in positive, positive kind of mindset, and
Right.
then that,
Right.
yeah, and so yeah, listen, and that's why like you do your podcast, with laughing in cancer. I do my podcast, Integrative Cancer Solution. And it's to have these inspiring stories. What did people do in order to be able to navigate this successfully?
Right.
And by arming yourself with these powerful stories, you start to live it and you become
Right.
it.
Right. I love it. Well, oh my gosh, we're almost at the top of the hour, and I just have to have you on every year, right? This will just be an annual thing. And I do encourage folks to get the book, but for people who are saying, Dr. K, we need to talk. And you do, people come from all over the world to Boise for treatment. But if they're just saying, I need to talk to you, and what, and so how do they find you, and what are the services that you provide?
Yeah, so we do offer telehealth, and yes, we
Mhm,
have patients flying in, coming and doing very powerful integrative therapies, during 2 4 week period
mhm,
of
mhm,
time where we hit it really hard,
mhm,
with the kind of cutting edge therapies
mhm,
that we
mhm,
offer. But the best way to start the journey, one, it is good to have the book. Yeah,
mhm,
either my
mhm,
last one that I
mhm,
co-wrote, Breast Cancer
mhm,
Breakthrough, or my earlier that I
mhm,
wrote a couple of years ago, A
mhm,
Better Way to Treat Cancer.
mhm,
Yeah, both of those are obviously, I think they're
mhm.
phenomenal because, I
They
feel
are
that this
good.
is,
They're good. Mhm,
yeah,
mhm,
thank you. But so the next step, if we want to have a conversation, is that we do offer a 15-minute free
mhm,
discovery call.
mhm,
So you can just call our center.
mhm,
You can go to our website,
mhm,
gain all the information
mhm,
about us. It's the
mhm,
karlfeldtcenter.com.
mhm,
And if you want to schedule a discovery call,
mhm,
then you can fill out a form
mhm,
online, give us a call, and then I support
mhm,
a lot of
mhm,
people through telemedicine
mhm,
from
mhm.
afar
Right.
and guide them through their
Mhm,
journey.
mhm. I love it. Yeah, I encourage you to get the books. And like I said, read the books now before something happens, so that you can start preparing yourself for it. But even if you're in the middle of your journey, or someone like me who's been doing this for 10 years, such great information in there to just help our health overall.
Yeah. I mean, the scary statistic is that we're moving towards 1 out of 2 being diagnosed with cancer at some point. So,
Right.
so then it's the same like driving a car. I mean, why do you put a seatbelt on?
Mm-hmm.
Well, you don't put it on just for that journey.
Right.
You just
Mm-hmm.
put it
Mm-hmm.
on for the what
Mm-hmm.
ifs.
Mm-hmm.
And so by
Mm-hmm.
learning prior to
Mm-hmm.
diagnosis, what are the lifestyle
Mm-hmm.
habits I should
Mm-hmm.
do? That is
Mm-hmm.
so important in my mind.
Mm-hmm. Right. Well, oh my gosh, I've been having so much fun talking with Michael Karlfeldt. That is a mouthful. That's why we say Dr. K, right? Um, and it has been good. And I think we should do this every year because you have such great information and things change, right? So we should do that. But until then, do you have any final thoughts that you want to leave everyone with?
Well, I really want people to know that there's always hope. When I have patients that come with very scary diseases,
Mhm.
and they've been told that they only have X amount to live, and they're still living. So there's a lot of hope. Doesn't mean that everything can be fixed, but there's amazing the tools that are out there and available. So I really urge everyone to really kind of learn and educate yourself, and kind of look around a little bit more than just kind of the normal therapies that are still very powerful, but just knowing that there are a lot more out there to consider.
I love it. I love it. Well, I am Deb Creer. I've been having so much fun talking with Dr. K. And until next time, everyone have a great day.
Tune in for our next program for even more trends, best practices, and techniques for how to make your business a success. The Business Power Hour, hosted by Deb Creer, is proud to be part of the C-Suite Network.